Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialised field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show, and that's to help guide you in the right direction. Now, if you'd like any further information on our programme or any of the topics that we discuss, please do get in touch. healthshow@islamchannel.tv. Today, we're looking at gum disease. Gum disease is the inflammation of the gums and is also known as gingivitis. If gum disease is not treated, it can develop into a periodontal disease, also known as periodontitis, and this can weaken the bones supporting the teeth. To explain more, we'd like to welcome Mr. Ishaq Mahmood, a general practitioner and dentist. Very warm welcome to the show. Thanks for coming.
Thank you very much for having me.
It's great to see you, and we're going to talk a little bit more to Mr. Mahmood in a moment. But first, we'll tell you a bit about him. Since graduating from the dental school in 2012, Mr. Mahmood has worked at the Oral and Maxillofacial Department of Aintree Hospital, as well as taking several courses to provide the best care for his patients. His interest mainly lies in managing patients with gum health issues and dental implants. Now, before we talk to him more about his work, we're going to take out a short video clip which demonstrates how Americans understand that a set of perfect teeth is more than just a health benefit. It can pay off in professional advancement as well. Dentists and orthodontists working in the subfield of cosmetics dentistry are armed with ever more sophisticated techniques, including 3D imaging and robot technology, to help their customers invest in their smile.
For Deborah, this trip to the dentist is putting a smile on her face. After 3 years of prep work, she's getting a set of porcelain veneers. 7 teeth at $1,800 a piece, each made to measure and color matched to perfection.
We can make teeth almost any color we want. We've got shade guides that, can select everything from your favorite European colors to maybe the more American style colors.
To prepare for this day, Deborah, a judge, spent 2 years with a retainer. Then her teeth were shaved down to make room for the computer-crafted veneers. The final step, bonding the veneers, takes only a few hours. Cosmetic dentistry is a multi-billion-dollar field and growing as more Americans find a perfect smile is worth their investment. For dentist Scott Finlay, it means a waiting list 4 months long. His business is up 12% from last year.
Some people are getting 4 teeth done, some people are getting 10 teeth done. There are some folks that come in and get 28 teeth done. The average big case might be $25,000 to $45,000, somewhere in that ballpark.
That looks great. Yeah. They feel like they're my teeth. I mean, I don't feel like I'm walking around with, pieces of glass in my mouth.
Preserved for the record, a before and after picture worth 1,000 words. Americans in a range of professions find it pays to look good. Leo is a partner in an architectural firm. He's got a new set of veneers he says gives the right impression to clients.
I think people have in their mind what an architect might look like, and some people look more like architects than others.
Judge Deborah says her look has given her greater confidence in and out of the courtroom. She's decided not to stop here. Her next move, veneers for her bottom teeth for a truly picture-perfect smile.
Well, Mr. Mahmood, it was fascinating watching that, and it certainly seems to be becoming increasingly popular. How big a difference does it actually make, having that sort of perfect-looking teeth?
Yeah, I think it makes a huge impact on the actual psychological well-being of that patient. And as you mentioned there, people in high-profile jobs or working with the public, a lot of the people will be often looking at their teeth, and that's the thing that gives the first impression. So having that perfect smile really does help boost self-confidence and also just make you feel a lot better about yourself as well.
Is there any actual dental reasoning behind having the veneers that we saw there and other types of treatment? Is it actually helping our teeth as well?
Yeah, so there are instances where you may need to have veneers for cosmetic reasons mainly. For example, there are certain congenital conditions where you're born with very dark teeth or discolored teeth, or perhaps your teeth were also very brittle since birth. And so by providing veneers or crowns, sometimes we can strengthen these teeth and actually preserve them in the long run.
OK, let's get down to some real basics first of all. We all understand dentistry is to do with our teeth. What can go wrong with our teeth? You know, we've all had pain at different stages and we've heard lots of different terms. Give us some real basics about what goes wrong.
Yeah, so there's a few common conditions that a person may experience in their mouth. So the first one with regards to teeth is known as tooth decay or caries. And this is where, and you know, due to a lot of sugars in the diet and perhaps poor oral hygiene, the tooth itself is destroyed and eaten away by bacteria. And this can actually cause a lot of pain and classically leads to toothache, which is very agonizing. And then with regards to gums, again, if not maintained and cleaned professionally and at home, can also lead to a lot of pain, bleeding, and a lot of bad smell as well. So these are the two main common complaints that were presented within the dental office.
And obviously we're concentrating on gum disease today. So what is it about not cleaning? Because, you know, you look at animals and things, they manage their teeth perfectly okay. So why is it so important for us humans to actually brush our teeth daily?
Yeah, so it's a good point you mentioned there with regards to animals. So there's differences in the types of gingiva or the gums between animals and humans. And again, there's also a genetic predisposition for certain humans to have gum disease. So our gingiva is very different to the animals. And it's important because gums can very easily be susceptible to bacteria, which you find commonly in the mouth. And the other thing to bear in mind is that there are certain bacteria which are only present in the mouth of humans, and these release toxins which then start to cause a destructive process on the gums.
OK, so the gums themselves, if they're not kept clean, and we're told a lot from our dentists about cleaning teeth, but before we get to that, and we've got some equipment here to do a demonstration in a while, I want to talk a little bit more about the importance of going to your dentist. What's a dentist going to do at a regular checkup that maybe you're not able to do on a daily basis through just cleaning your teeth properly?
Yeah, so dentists will be looking at for 2 or 3 main things. So the first thing they may look at is the health of the gums. And so they will usually probe around with a fine instrument to see if there's any bleeding around the gums, and in particular towards the back of the mouth where it's quite difficult to visualize yourself in a bathroom mirror. So that's the first thing that they may be looking out for. Dentists will also be able to detect any decay in the teeth very early on through different techniques, in particular by taking radiographs routinely. And sometimes it's only on a radiograph or an X-ray where you can actually detect any problems. And obviously you can't do that at home, so it's very important to visit a dentist to check that.
And there obviously, you mentioned earlier on that there are some congenital situations that people might have. Is it normal that, you know, if your parents have weak teeth, if they have problems with their teeth, is it likely that you're going to have the same issues?
There are a few conditions which do have a very strong family history, in particular ones which do lead to very brittle teeth. So a particular condition, for example, called Hypo Mineralization, is where the teeth enamel, it doesn't really form very well, and so in fact just dissolves very quickly. And this is something which again runs in families, and it is quite likely that if you have it or someone in the family, then your children and offspring may also suffer with that same condition.
So we all know we should go to the dentist. There's some people who, you know, are terrified of the dentist. For people who haven't been for some time and they just don't want to walk through that door, how much have things changed over, say, the last 5, 10, 15 years that might allay people's fears that it's not quite as terrifying as it might seem?
I think things have changed tremendously, actually. The government has started to introduce new protocols and encouraging dentists to do a lot more preventative work. So actually working with patients to try and educate them on how best to look after their own teeth and their mouth in general. So a lot of that is equipping patients with the tools that they need at home. And in terms of actual pain and you know, relieving those anxieties, again, definitely there's a lot of new materials and also new techniques whereby there's a lot of treatment which can be done without anaesthetic. And furthermore, there used to be this classic fear of a large needle, you know, for the anaesthetic. And quite recently, we've actually got injection-free needles or injection-free anaesthetic. So you may not even need to have that to have a tooth numbed up.
So, I mean, that is, as you say, that is the biggest fear. It's the drill, it's the needles and things. So actually, it shouldn't be as terrifying as it seems. And how tough are you going to be on people who maybe haven't been to a dentist for a number of years?
I think it's important as dentists to realise that there's a lot of factors why a patient may have not been able to go to the dentist. We can fully appreciate that access to NHS dentistry is very limited in certain parts of the country. And then there may be other reasons, such as being very busy in a very hectic lifestyle. So I think it's important not to always judge patients' reasons for not attending, but I think what I personally do in my own practice is really encourage them to come back every 6 months. And I think it's nice because it also builds a relationship between myself and the patient, and a lot of trust can be built, which then can lead on to further treatment later on.
So you recommend about every 6 months. Why is that the period of time that is normally recommended?
So there are actually guidelines published, and these are all based on a lot of scientific evidence. And the evidence is that within that time frame, there is a possibility that a new occurrence could have happened or a new problem. And by detecting dental disease early, it's a lot less painful, it's a lot less invasive, and it's a lot less costly as well for the patient. So there's a big drive to try and prevent things from happening in the first place. And so 6 months.
And you're going to prevent a lot of potential pain as well if you look after your teeth. What about the ageing process? What happens to our teeth as we get older, and what extra care do we need to take as we get older? And what are the key milestones in terms of age that we should look out for?
So we are seeing an increase in the ageing population, and some of the common complaints that they may experience are teeth which are very brittle and liable to fracture through many years of usage. So not due to disease as such, but just because they've become weak over time. So wear and tear is a common problem on teeth as well. So that leads on to tooth wear, again, from brushing our teeth daily, the acids that we have in our diet, and brushing them after the drinks of coffee and Coke and all these sorts of things over many years can lead to teeth becoming very worn down, very brittle. So that's one of the main complaints that they may experience. And the other one really is to do with a lot of gum recession. Again, the gums generally are healthy, but because they've been abraded with a toothbrush and just from wear and tear over years, the gums can recede, and this can lead to teeth becoming very sensitive and very difficult to function with as well.
And we're going to come to the whole technique of how we should be looking after our teeth at home in a moment. But first of all, I just want to ask about what we do when we eat and drink, and whether we should be brushing before, afterwards. Are there particular foods that maybe from a dentistry point of view we should be avoiding them?
Definitely. So the message that dentists will be giving out to their patients are it's okay to have sugars. It's part of a normal healthy diet as long as they're restricted to just straight after a meal. So I would normally advise my patients to have any sugary drinks, foods, anything like that straight after a dinner or after a lunch. And that's to minimize the number of times that sugar is present in the mouth. And the same goes with any acidic drinks or acidic foods. So acids are a little bit more sneaky in that they can be found in many foods and you may not realize. So in particular, the common one being fruits such as lemons, grapefruit, oranges. So very citrusy fruits have high concentrations of acid, and it's very damaging to teeth. And so these are the two main areas that we're looking out for in a patient's diet.
So you should have those kind of products and drinks and foods at the end of a meal. Is that because it sort of dilutes it a little bit in terms of the mouth?
The basic science behind it is that when there's sugar in the mouth, the bacteria have some food to feast on, and so they'll start to reproduce and they'll start to release those toxins, which will then go on to cause dental decay. So by reducing the frequency of these sort of sugar exposures, we're sort of starving the bacteria of those frequent attacks on our teeth and our gums.
OK, before we talk more about the diseases and things that you can get, and if you don't look after your teeth, let's do a positive thing for a moment and have a look at teeth. So if you wouldn't mind picking the mouth up there, and if you just take it into your hands and keep it nice and still so that then our camera can pick it up. And if you just give us a few tips there about how we should be brushing our teeth. Now notice, first of all, you've got a normal handheld brush there as opposed to an electric brush. What's the difference and which should we really be using?
So again, studies do show that electric toothbrushes do have a potential benefit over a normal manual brush at removing the plaque and the bacteria around the tooth. But equally so, if used incorrectly, can actually be doing you more damage because you may not be able to access certain areas. So I'd always recommend to be a master really at using a normal toothbrush before using an electric one. In particular for manual toothbrushes, they're very easy to get hold of. And particularly this type of brush where you have a very soft bristle. It's very important because teeth at the end of the day will wear down. So using soft bristles is the first sort of tip that I would advise. In terms of brushing the teeth, really quite simple. It's ensuring that you don't just brush the teeth on top, which quite often people will do because they're in a rush, but also ensuring that you do introduce the toothbrush right down to that gum level, because by doing that you'll be removing the plaque which is sitting along this gum line here, and the plaque there is going to cause gum disease. So that's the first thing that I'd advise, is to ensure that you're brushing both the teeth and the gums as well. And some more gentle circular motions as opposed to backwards and forward strokes, because again there's less damage in doing small vibrations. So that would be the
I was going to say,
technique.
because you mentioned earlier on that if you do it wrong with an electric toothbrush, you're causing more problems. Is that because of what you're doing to the gums potentially?
It is. So by moving the electric toothbrush, it moves at a very, very fast rate. And so it can actually cause tears in the gingiva or in the gums. And these over time can start to lead to recession. So again, if putting too much force on with the brush, either manual or electric, that can start to make the gums recede. So normally a normal manual toothbrush is sufficient for the majority of patients, and electric ones may be for those who are have special needs or certain requirements. Those are available for them as well.
Okay, and you've also got another gadget there, which we've heard of flossing, and this is something a little bit more technical, isn't it?
So flossing can be difficult, and we fully appreciate that as dentists. So if you're struggling, this is called an interdental brush. So what you're doing with this, just like floss, is you're actually introducing it in between the teeth. Now, unfortunately, it doesn't go through on this model, but by inserting it into the gap between the two teeth, it'll come out the other end, and you're cleaning or flossing in between. And that's going to remove any food, any bacteria which is stuck in there. And if that's left behind, that's going to start causing gum disease and decay. So these are very, very useful, and they're easier to use than floss.
And to know which one and what type of floss and so on and so forth, is your dentist probably the best person to ask? Will they be able to tell you what type of brush, what type of interdontal brush you use and floss and so on?
So these brushes actually come in a variety of colours, and they all come in different sizes. So actually this grey one is a very large one. There's much finer ones than this. And so it's important to speak to your dentist or your hygienist, and they'll be able to check in your mouth which colour is going to be the best one for you, and also show you how to use it correctly, because again, if used incorrectly, they can also cause trauma to the gums.
And is that something that a dentist would be able to pick up? Would they be able to pick up that actually maybe your technique is wrong because it's showing on your teeth and your gums?
Exactly. So we quite often see patients who may have brushed excellently that morning because they were coming into the dentist, but unfortunately we're very clever and we're able to tell, because there's certain signs in the mouth that will tell us that that person's not brushing routinely. And so the gums may appear a little bit red and they may be tender, and that's a telltale sign that the patient isn't actually cleaning effectively. And so we are able to tell if the patient's not cleaning as we'd like them to.
Now, we obviously want people, and we're encouraging people to go to their dentist every 6 months. That's the best way to keep a check on things. And if you're not doing something right, it's obviously going to become evident at that point. Is there anything that we should look out for in our mouths when we're standing in front of the bathroom mirror in the morning and the evening? What are the sort of things that we should be looking out for?
So one of the things, and in particular with gum disease, you would be looking out for any bleeding from the gums. Bleeding you wouldn't expect anywhere else on the body, and equally so, if there's bleeding from the mouth, it's actually raising a red flag, and it's something that should be seen to very quickly.
Is that a one-off bleed, or does it have to be consistent over a period of time?
So a one-off bleed may be okay, maybe that you just hit the tooth in the wrong position, but frequent bleeding that's not going away or actually getting worse is something that really needs to be addressed by a dentist. It could indicate an underlying gum condition, amongst other things as well. So that would be the most common thing that you'd be looking out for. And also any blackness or any brown areas on the tooth, that could indicate that there's some decay starting to form on that particular tooth. Again, needs some professional intervention.
One of the things that we encourage people when it comes to their health care here on the Health Show is going to a pharmacist, because they're there all the time. They're in our local chemists and so on, so we can see them a lot. How much training do pharmacists get in dental treatments, and are they a good place to go for an initial consultation just to get an idea if something's wrong or right?
Yeah, so pharmacists will be aware of some of the common conditions that can occur in the mouth. However, they don't have the training which is required, because there are certain conditions. For example, bleeding gums, it may indicate gum disease, but also they could indicate more sinister problems such as leukemia. And so really they're not trained enough to be able to differentiate between those two things. But what I would advise is, if you did need to see a pharmacist, they can help you with certain things, such as choosing the right toothpaste, but also choosing products such as mouthwash and interdental brushes as well.
I was going to talk to you about that, actually. We see a lot about mouthwashes, and actually there's a bit of, we hear some myths about it, that some people think that it's good, some people don't think it's good. There's different types of toothpastes and things. Give us a quick overview of the sort of things we should be looking for and what we should be using.
So toothpaste, and I agree with you that there's so many on the market that it can be very confusing. And in all fairness, really, most of them are very similar. So a good toothpaste which has the optimal amount of fluoride, and if you were to look on the packaging on the back, it will tell you how much it is, and you're looking out for that magic number. It's 1450 or 1450, and it'll say something like ppmf. That basically is the optimal fluoride concentration that you can get without a prescription in the UK. And so that's what you'll be looking out for in terms of your toothpaste. There are certain toothpastes which claim to be able to whiten your teeth and do all sorts of miraculous things, but really they're not really evidence-based. So just a normal toothpaste would be sufficient for preventing tooth decay. Mouthwashes are more of an adjunct as opposed to a treatment for gum disease or any dental disease. They're there really for helping at times of difficulty, if you're unable to clean your mouth for whatever reason. And the important thing to remember is that they're not really able to get into the areas where the diseases commonly occur. So in between the teeth, you're not really going to be able to get any mouthwash there. So really,
is it really necessary to, because some people will use a mouthwash every single day. Yeah. Is that something you would advocate?
Actually, I wouldn't, no, because there are certain mouthwashes which contain high levels of alcohol, and there are certain papers which have been published to demonstrate a link between that and certain cancers, oral cancer being the most common one. Other things to bear in mind is that they can also disturb your taste in your mouth. Because they're very strong, they can cause damage to your taste buds. And again, that's something that can't actually be reversed.
So under normal circumstances, if you brush your teeth properly and well and you floss, then you don't always need it. Just have it there in case you can't make it to brush your teeth sometimes.
Exactly. So I think if I was to use mouthwash, it'd be something that I'd use after I've had lunch quickly, or if I need to just freshen up before I'm going to meet someone. It's more for that, really, just to make your mouth feel a bit fresher, as opposed to actually as a replacement for good toothbrushing.
And there are some mouthwashes, of course, that contain alcohol, which, of course, many of our viewers will absolutely not want. So you just need to, again, look at the packaging for that.
Definitely. And we are quite fortunate now that these manufacturers have recognised that there is a need for alcohol-free mouthwashes, and a lot of them are available. Again, they are just as effective as the other ones, but still the same things can occur, such as taste disturbances, discolouring of teeth being another major problem that mouthwashes can cause.
And we're going to talk in a little while about children and children's health, because we'll have a lot of viewers who will be wanting to get their children on the right path with that. And actually we'll come to more of that in a while, because also I want to talk about children who use braces, how they should best look after themselves. And then, of course, we'll talk more about the various diseases and things, and more importantly, the treatments that you can do. But I'm afraid already we're time for a break. But thank you so much already. It's been some great, really useful information. So thank you very much. And what we should stress at this point is that should you suffer from any medical problems or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As I said, it's now time for a short break, but don't go away. We'll be right back. Welcome back to the Health Show, where our topic today is gum disease. Now, periodontal disease is explained very well by watching this particular short film, which highlights the human side of the disease through stories of patients who generously gave up their time to talk about their experiences.
I live about 5 miles from golf club, and I have been very eager to improve my game. And I used to come up here nearly every day. Very enjoyable, and it's sociable. I enjoy life. It wasn't always that rosy. When I was having my dental problems, I had some dark years. It started off with a burning sensation in the gums. I would be tender and bleed on brushing your teeth. Also, most embarrassing thing was bad breath. That used to terrify me. I was so afraid of opening and exposing my ugly side. I couldn't chew properly any hard stuff. How I used to envy people biting into the apples, which I couldn't do. It was something I couldn't talk about because the problem was caused by my poor oral hygiene, so I felt shame. I wasn't speaking up as much as I would have done with a cancer condition. People can talk about it, whereas with a dental condition, I thought that perhaps I will find a way of treating it without making too much fuss. When I made a visit to dentist, it never really cured anything. But when it went on for years, then I was very frightened. I started losing teeth, and I knew, no, this is serious.
I've got a fairly hectic schedule because we've got several businesses that we run as a family. I run a couple of coffee shops, a bakery, a couple of sandwich shops which we've just opened up as well. You've got to be there for each different business. I've lived in different places like Africa, which was exciting. Had a great time living in a different country, different culture, but I don't ever remember in that 10 years going to a dentist. I decided to come back from Africa, and I did start going more regular. I remember having fillings. There was nothing discussed about gums. Even when I brushed my teeth and I spat and there was some blood inside it, it didn't register any alarm bells because I actually probably thought I was just brushing a little bit too hard. I've been with this dentist since I can remember, and he sold his practice to some other people. So I was still brushing, still bleeding, but not thinking anything of it. And I went in this new practice, sat me in the chair, and I said, oh, we think you need to have some treatment on your gums. Even when I got told I had a gum disease, I didn't think it was like anything serious. I was a bit shocked, but not horrified, because I didn't realize, if your gums get bad, then your teeth will actually start dropping out.
I'm 65 years old. I retired 3 years ago. We found this place. We've spent a bit of time getting the garden right. It's perfect. Like many people of my age, I had a fear of dentists. I used to get myself into a terrible state and would often cheat on appointments and not turn up. So, of course, when I went away from the parental home, I did even less other than brushing my teeth occasionally. No one explained in terms that I could actually process what the consequences were. I actually realised I had a sensitivity to my gums in my late 20s, early 30s. I got gingivitis. It then started a series of surgical interventions on all sides of my mouth, and that lasted over a year. And I can remember the words of the surgeon, if you now don't take your gums seriously, you will lose your teeth. The penny does begin to drop, but in actual fact, I had to take myself seriously, which is what I did. My wife Pam has been through a similar set of experiences recently, so we share that common bond.
I suppose I first became aware about 2 years ago that it was a gum disease rather than anything else. I'm very pleased that it's been spotted because obviously before that point you don't know why it's uncomfortable and you want it to go away, and of course that always takes time and you can be fine for a while, but the inevitability is that it will come back.
Well, it's great again to be talking to you, and watching that video we got a really good idea of how serious it can be if you don't take action. Give us a time frame of, say, somebody who doesn't do anything. The signs are there, they've got bleeding gums, it's uncomfortable, the bad breath has started. How long could it be before you start losing teeth?
So it's important to remember as well that there are different types of gum disease. So one of the gentlemen in that program there mentioned that he'd had it for maybe a few years. He'd never really been to the dentist, but he'd always had bleeding. It was only until a new dentist came onto the practice that he realised he had gum disease. Gum disease can take months to years to develop, but there's always destruction going on in the background. The risk, however, is that there is an aggressive form of gum disease, and that can rapidly cause destruction of the gums within weeks to months. And so if you're one of those unlucky few, you could end up with a lot of problems in a very quick period of time.
Now, you said there's different types of gum disease. Do we as the general public need to know what they are, or is that something that actually you've got gum disease, go and get it sorted?
So there are milder forms. So the mild form of gum disease is called gingivitis, which is where there's no actual destruction of the bone which is holding your tooth in, but the gums are just not really being cleaned well, so they're a little bit inflamed and they bleed. That is completely reversible with just correct toothbrushing and good oral hygiene. However, the more serious form of gum disease, periodontitis, causes actual loosening of the tooth and destruction of the bone which is holding that tooth in, and that definitely is something which needs to be seen by a dentist or a hygienist.
And what's the treatment in those circumstances would you give?
So we would normally classify our treatments into two broad categories, one being a non-surgical approach and the second being surgical. And the majority of patients will go down the non-surgical care pathway. And in effect, what we're doing is actually effectively cleaning deep underneath the gum where there are reservoirs of bacteria and toxin. And by flushing these out of the gum and then teaching you how to correctly maintain that at home, the gum then has a chance to just reattach back onto the tooth, and that would be what most patients would require. Surgical intervention is occasionally needed if there's a particular area in the mouth where the gum disease isn't responding to that non-surgical treatment. And again, that would only be required if the gum disease hasn't quite healed as we would have liked it to. And
then you're getting into the realm of implants.
So implants would be a possibility. The important thing to remember is that although, if you were to remove a tooth, there are still bacteria in the mouth, and an implant is just as susceptible to gum disease as a tooth is, and equally can just fall out. So it's important not to use it as a quick fix option. However, it's important to realise that teeth are much better than anything that you can ever put in your mouth. Implants are reserved for patients who have lost a tooth. Surgical techniques would usually be some form of minor surgery to try and reduce the amount of gum probing around the tooth and try to get the gum to reattach back onto the tooth very, very quickly.
And thinking about, when people get gum disease, this is clearly something that you specialise in. So is it something that you can sometimes be referred to, or will this be something that every dentist should be able to take care of?
Definitely. So again, it does depend a lot on the actual dentist techniques and skills and their own level of expertise. Gum disease can be treated by general practitioners out in primary care dental practices. However, there are certain cases which are not responding to the treatment that we've done, or perhaps they're an aggressive periodontitis case, and these cases should usually be referred to a specialist periodontist for further treatment and assessment.
Are there any elements of dentistry which are specific to certain ethnic communities? So, for example, are they more prone to certain diseases, or is there any evidence that they're more or less reluctant to go to dentists in the first place?
So I think there are cultural attitudes with regards to accessing dental care, or perhaps even medical care in general. There is always this idea sometimes that we don't need to, it's not a serious condition. I find quite often that the South Asian community patients tend to present very late with their symptoms. So although they will present, unfortunately there's been a lot of damage done, and sometimes all we can do is really just take their teeth out for them to relieve them of the pain. And so that's something that I have noticed. In terms of dental conditions affecting certain communities, there are certain conditions which affect black and ethnic minority communities much more. Certain oral cancers are more prevalent in these communities because they may be chewing pan and supari, and these are things which can really cause a huge amount of destruction to the gums and the oral cavity in general.
Actually, that brought us very neatly onto something I did want to talk about, which is chewing gum. That some people see that as a form of dental hygiene, like mouthwashes or something like that. Let's do a little bit of myth busting now.
Yeah.
Let's talk about some of these preconceptions that people have, whether they're true or not true. You've already talked about mouthwash. What about gum?
So in terms of gum, it's actually got a lot of scientific evidence to suggest that it's very useful. And at the very basic the basic theory behind it is that chewing gum, which has no sugar in it, by the way, so xylitol, which is a sugar-free version, it encourages the saliva flow in your mouth. Now, saliva is very, very good for many reasons, but one of the reasons is because it actually contains certain bug-fighting mechanisms. So by flushing away the bacteria from the mouth, and also it contains certain antibodies, these directly affect the bacteria and destroy them. So the more saliva that you have in the mouth, the better. And gum is one of the ways in which we can increase our saliva flow.
So actually chewing gum is good?
It is, as long as it's a sugar-free version.
And what about the, yes, it makes sure a sugar-free version. And what about the whole jaw health? Because obviously in dentistry you're going to be very much involved in that. Is there an element where chewing gum is good for the exercising of the jaw?
It is. So one of the things that gum can actually do for you, increasing the saliva flow also lubricates everything in the mouth. And you'd be surprised at actually how important that is. It's only when you don't have it you actually realise that it's very important. And so by lubricating the tongue and the teeth, it actually aids with function. In particular, it does help also reduce a lot of oral conditions such as thrush, which can be very debilitating because it recurs very, very quickly as well. So yes, it's very important for lubrication as well.
What I'd like to talk about now is children's health and looking after their teeth. And I know that we want to get children involved in looking after their teeth at a very, very early age. But talk us through the process. So at what stage should we be starting to brush their teeth, taking them to the dentist, and that whole process all the way through their lives and into teenaging years?
Yeah. I mean, I totally agree. It can't be underestimated. If I was to tell you that last year there was a report to say that £35 million was spent by the NHS on extracting children's teeth, it highlights the problems that we've got in our society. So starting off really young is the key message. So as soon as that first tooth erupts at the age of about 5 or 6 months, it's important to start brushing that tooth with a normal children's toothbrush. It's probably better not to use any toothpaste just because they could swallow that, and a bit too much of the fluoride can give them a bit of a tummy upset. And also at the same time, at around the age of 6 months, to start taking them into the dentist so that they get comfortable in the dental chair. Between that age until about 3, the teeth will start to come out, and then when they start to reach the age of about 5 or 6, the adult teeth will start to come through. And this is your cue to then start using an adult's toothpaste, because the new teeth which are coming through are going to need a little bit more of an enhanced protection. So during that period, it's important to ensure that the children are really looking after their teeth by brushing them twice a day with a good adult's toothpaste, and making sure that they spend a couple of minutes doing that in front of the bathroom mirror and really having a good look. Between the ages of 6 till about 9 or 10, nothing really much happens. And then at the age of 10, more adult teeth will start to come out. And it's at this stage where we start to look at maybe repositioning the teeth if they've come out in a bit of a funny angle. So that particular speciality is called orthodontics, and orthodontists will be looking at seeing if there's a functional problem with the way in which the teeth have erupted. And it's important to bear in mind that if a tooth is crooked or if it's not come out in a nice position, it can also affect the child's psychological well-being. Quite often we hear reports of children being bullied because of their teeth, and all sorts of nasty names are given. And so by correcting that, you can really boost a child's self-confidence. At that particular age, it's very important to also ensure that the child is really looking after their adult teeth, because they've now got a full set of teeth which are going to have to last them for the rest of their lives. So it's a really important thing to get the children into the dentist right from day one when those first teeth erupt at 6 months.
And in Britain, we sometimes had a bit of a poor reputation when it came to our teeth, but we've definitely caught up with that. And you now, if you are a teenager, you are probably going to be one of many youngsters who are going to have those braces on your teeth, and they're not quite as invasive as they were when they're younger. What about looking after your teeth while you've got them on? Are there any special things you should be doing?
Definitely. So it's important as well to be cleaning in between the braces, because once you've got those braces on, they are a food magnet. So as soon as you've eaten, it's important to get one of those small little interdental brushes and start to clean in between the braces around the metal wires, and just removing any food debris that's been put in there. Also very important is to regularly go to the dentist, because what they'll be doing is they'll be checking out if their gums are healthy, making sure that you're effectively removing the plaque and the bacteria around your teeth. And the dentist may also wish to apply some fluoride gel onto your teeth to strengthen them whilst they're being moved.
And is it still 6 months for those youngsters, or would they need to go more frequently?
So generally they'd be advised to visit their dentist 6 monthly, but if there is any areas of concern which has been brought up by the dentist or the orthodontist, then they may need to attend more regularly. As well.
Now, obviously, I come from a generation where I remember sort of older people having false teeth. Yeah. Is that something that really can be avoided, or is that a bit of an inevitability?
I think definitely it can be avoided. There is this, this sort of misconception, I suppose, that your teeth are going to come out, you can't do anything to stop that. But actually, we are starting to see a lot of patients holding on to all of their teeth very well into an older age. And the basic messages are really to ensure that they're looking after their teeth by brushing them regularly, ensuring that they're flossing and cleaning in between the teeth with those interdental brushes, but also getting their teeth checked out very early on and routinely, because as soon as anything's picked up by the dentist, they're able to treat that before it becomes a big problem and the teeth may need to be then removed.
Now, you obviously specialise again in gum disease, and you see a lot of different things. Just give us a bit of inspiration of people maybe that have come through your practice door with maybe not the finest set of molars, and you've been able to turn their lives around.
So a recent example that we had was of a gentleman who came in and he'd had lots of treatment done but hadn't really paid attention to his gums, and he was at a high risk of losing probably around 7 teeth, and that would have had a huge impact on him. And actually, by working with him and educating him how to look after his mouth, we were able to reverse a lot of the damage and the gum disease just by good oral hygiene. And in fact, we only had to remove one of them in the end. And so he's saved a lot of money and not had to have any implants or any dentures, but also he's got to keep his teeth. And we mentioned before, there's nothing better than your own natural teeth. So there is definitely a lot of light at the end of the tunnel, as long as it's checked out by a dentist or a specialist.
So never too late.
Never too late at all, definitely.
And we'll have a final sort of recap in just a moment, but I just want to very quickly touch on whitening. Are there any reasons why you shouldn't whiten? We all know that it looks nicer and we sort of look like the archetypal adverts of good, healthy teeth. But is there any negativity towards that at all?
So actually, one of the reasons where you may not wish to do any tooth whitening is if you've got active dental disease, and that definitely is a no-no for us. So if there's dental decay which is not being controlled, if the hygiene in the mouth is poor, and if there's active gum disease, these are priority and these must be rectified first, because whitening can actually cause more problems than it can cause benefit.
And especially these home kits, maybe, if you're doing it without realising. So would you recommend that people only whiten once they've been to their dentist and checked with their dentist?
Most definitely. It's very important to have a good dental assessment, make sure that your teeth and your gums are ready for this treatment, and ensuring that it's only a dental professional which carries out the whitening, because if done wrongly or done by self-medication, some of the effects can be devastating and require a lot of time and surgery.
Now, we talked right at the beginning of the programme all about the myths that we want to try and debunk, and certainly the one about, you go to the dentist, you haven't been there for maybe 10 years or more, and you're going to get told off, you're going to be almost punished. Could you just put people's minds at rest that actually, don't worry, if you haven't been, it's still good time to go, and actually there's no time like the present? Yeah,
most definitely. It's never too late. Unfortunately, with new advances in technology and treatment, we're actually able to save teeth which maybe 10 or 15 years ago we would have had to take out. So definitely, if fear is one of your main problems, then try to find a dentist who has a good reputation for working with anxious patients. There is sedation available just to help calm your nerves if you need any treatment, and you'll find that as soon as you start to build that relationship of trust with your dentist, you'll be at ease in the dental chair. So most definitely get it checked out, don't leave it too late, and if you do need any treatment, then always remember that there's things that can be done to make that treatment a little bit more comfortable for you.
You said there about people and dentists who can put you at ease. What do you do to put your patients at ease?
I think the number one thing is communication. All about communication. As long as you're honest and open with the patient and you're friendly and non-judgmental, and eventually the patient will be able to open up. And I think it's important to maintain an environment of calm and serenity. And these things are things that I employ. So talking gently to a patient, befriending them is probably the best thing that I could advise, because as soon as you trust someone and you're friends with them, then, there's nothing stopping you at all.
Exactly, and as you say, you know, with anybody, and especially somebody who's looking in your mouth, you absolutely want that trust.
Exactly, definitely
It's
do.
been absolutely brilliant. Thank you very much
for having
indeed.
me.
But unfortunately, that's all we have time for. But I would like to thank our guest today, Ishaq Mahmood, who is a general practitioner, for coming into the show and discussing the importance of gum disease and the basic habits you need to maintain to keep your gums healthy. Again, we should stress that should you suffer from any form of medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives an alternative viewpoint to the health concern being discussed. Again, as always, if you'd like to find out anything more about this or any of the subjects we've discussed on any of our shows, please do email us at healthshow@islamchannel.tv. But for now, it's goodbye from me and from all of us here. See you next week. Assalamu alaikum.